probably gonna regret this, but I'll go another bite. I'm afraid to swallow.
Oh, this is bad. This one's really.
Hi everyone, I'm Michael Elliott with Valley Health Foundation, and welcome to Spice It Up, inspired by the show Hot Ones. We're raising money for Giving Tuesday today, and very excited about our guest, Dr. Sarah Rudman, the newly appointed health officer and director of the public health department here in Santa Clara County. Congratulations and welcome to Spice It Up. How nervous are you right now?
I'm gonna say medium nervous. It's not as bad as a press conference. You're getting grilled by the board. Definitely worse than some of the more interesting questions my 6-year-old asked me, like where babies come from. Yeah.
What do you compare this to measles? Measles is worse, probably.
Oh yeah.
Yeah.
Oh
yeah.
Yes, I would bathe in that before I want measles.
Okay, that
Yes.
is saying something about how much we should want to avoid measles. And so in general, your spicy tolerance in food, do you eat a lot of spicy food?
I enjoy it, but don't tolerate it well. We'll really see how this goes.
Okay.
Yeah, I would say my tolerance is fairly low.
Fairly low. Okay. Yeah. Well, we're gonna start off. This is the Hot Ones Pickled Garlic Sriracha hot sauce right now. They rate this a 3 out of 10. You can handle this.
I hope so.
You have this. So this is. I'm gonna put a little on your plate. Do you mind if I serve you here?
Please do.
And you
Thank
can you can just take it.
As small.
Yeah,
as
yeah,
possible.
you control. You can control here. Are we gonna use? Okay, I'm gonna follow the health officer's guidance here.
I washed my hands before.
Okay,
I
then
came
let's
here.
just be real about this here.
Okay.
Let's enjoy our incredibly air fried cauliflower. Cauliflower, good.
Yeah. Cheers! I like it. Okay, it's definitely delicious. It hasn't hit me yet.
Yeah, I think this is. You can handle a 3. So you just got this job in maybe what is the most, I think, fascinating undersells it because it's probably also terrifying and unmoored time in recent public health history. Talk a lot about how you are thinking differently in this role now as a local public health officer, knowing that the national scene is quite bleak.
Absolutely. I mean, I think there's no question I would not have accepted this job in any other county because I think we happen to be in a place here in Santa Clara where between our amazing health system, the level of community support, the level of support from our political leaders to actually make the choices that are the best for the health of Santa Clara County is there in a way that I don't see it in lots of other places in the country. So I'm again, less nervous here than I might be anywhere else jumping in the current moment, but it is a terrifying time for public health. The changes we're seeing happen at the federal level are not good for the health of most people here in Santa Clara County. It's becoming harder for me to do things like know if the next measles outbreak is around the corner and stop it in its tracks. It's harder for me to make sure people have access to healthy food. It's harder to make sure people are protected from violence. So it is a wild time to be stepping into a new leadership role in public health, and I wouldn't do it anywhere else.
Well, thank you for doing it, and let's continue to thank you by making you eat uncomfortable.
By torturing me.
Yeah, it's a slow torture.
Okay.
This is Los Calientes. This is a 5 out of 10. So that was, I think you brushed that off.
That was fine.
You brushed that off.
I enjoyed that.
Yeah. What is your go-to type of food? Like Desert Island, this is the type of food that I want to have.
Desert Island, my
genre food.
Yeah. Oh, seafood.
Yeah.
I'm gonna say like seafood of some kind.
Okay.
I'm a combination of Jewish girl who likes her smoked salmon and New England person who likes their raw oysters. Now, raw oysters is a weird choice for a health officer.
I was gonna say.
Yeah.
It's a weird choice in general. I could just never get into it.
It's infectious disease roulette.
Yeah, it is, isn't it? Yeah.
I don't recommend it to the general public.
No.
But I do love me an occasional New England raw oyster.
You should have me on a raw oyster show, and then I'll be the squirmish one because I just can't get over just
I wouldn't do that to you.
The disgustingness of all of it. Okay, let's try this now. Okay,
I'm ready.
Okay,
Let's do it.
So this is a 5 out of 10.
Okay.
I'm gonna get a little bit more here. You're fine.
I am so far.
Yeah.
You never know.
Like I'm giving you encouragement. I'm just telling you.
Give it.
You're fine.
Oh, thank you. I feel reassured by that. Thank you. Okay. I think you're right.
Yeah.
Yeah. Either it hasn't hit me yet or it's doable for me.
People are unfortunately now getting such unbelievable nonsense from people in power. Like, for example, the Secretary of Health and Human Services that tells us that, I didn't even quite follow that, don't give baby Tylenol to your baby or something, and there was an autism link. Just absolute nonsense. That's got to be impacting your work significantly. How are you managing it? And of course, you're not new to dealing with health disinformation, but another level.
Well, I think part of what's so frustrating is some of where this comes from are smart questions. People want to know, pregnancy is a scary time. How do I keep my pregnancy healthy? How do I keep myself healthy when I'm pregnant? Good question to ask. And people deserve accurate information when they ask that question. So when I see something come out of the federal government like there may be a link between taking Tylenol or acetaminophen during pregnancy and autism, I'm not willing to just brush it off. I think the people in Santa Clara County are owed a public health department who actually looks into it and says, am I very sure about what I'm about to say? Unfortunately, I don't think some of our federal partners are applying that level of rigor to these questions. So when that one came out, we diverted smart people from doing other things like tracking how flu and RSV are hitting us to going back through every piece of the literature. I myself read the publications to try to understand, why does anyone think there might be a link between Tylenol and autism? Is it real? Is it not? What do we need to know about it? It turns out the bottom line is there is probably no link, and Tylenol continues to be the safest way to control a fever or pain during pregnancy.
Which are dangerous.
Which are
things.
dangerous.
Yes.
Right. And so what actually probably where some of the misconception is coming from is that there may be some contribution of having fevers and getting sick during pregnancy with autism.
Interesting. In
the context that most autism has genetic links that we already understand a fair amount about. So I think what's so frustrating is that there are really important things people need. They deserve to understand more about where autism is coming from, and they deserve resources if they or their family are impacted by autism that match their need. And that's sort of being forgotten about in these crazy pieces of information that are coming out of Washington and elsewhere. And they deserve a public health department that is continued to devoting its time to what's most important for us right now in Santa Clara County, as opposed to the latest piece of misinformation, and making sure that we understand where it's coming from and combat it. So it's been frustrating, but I'm lucky enough to have the team we have here that helped us really look through the evidence and get people accurate information.
Let's add to your frustration.
Oh, thanks. Okay.
This one is bad, and I'll just warn you right now. But you deal with bad things. That is your public health background. In fact, let's start with that. Though it seems like you were fully formed as a public health officer, you actually worked your way up the ladder, so to speak. You were a practicing physician in a hospital setting, and then got inspired in public health. Talk about what brought you to the public health world in this one, and I'm just going to again tell you that this one is terrible, but it's going to be great for us to enjoy it together. It'll deepen our bond that we have.
I can't wait. Okay, so I will start to answer your question before I put this in my mouth, just in case.
Oh, I think it'd be more fun if you ate it first and then answered it. So let's do that first. Yeah. So this one again. Let's just this will be
light on it.
Yeah. Okay. Here we go.
Cheers.
Ready? Cheers to you.
Felt that one right away. It's not a nothing. Oh, okay. Yep, let me try to answer your question. So that's the first one that really hit me.
Yeah.
I feel it. I loved being a clinical doctor and treating patients one-on-one in my office and having that connection with someone where I could really understand what mattered to them. You can take a drink if you need a drink.
0% alcohol, because that's the fizzy. Anyway.
I'm still going to try the milk.
Yeah.
But what I loved about being a doctor one-on-one was really understanding what that particular person needed from their doctor and meeting that need. But I would have these interactions over and over again where somebody would say, I need a sleeping pill because I can't sleep at night because there are gunshots in my neighborhood. And I'd say, I mean, I can get you a sleeping medication or a meditation app.
How about those gunshots?
But let me do something about the gun violence in your community. Or, I can treat your sexually transmitted infection, but if you had the information and the resources you need and the ability to make decisions about your own interactions with people, we wouldn't have to have this healthcare interaction to begin with. I can take a step back and prevent your illness at a population level. So I wanted a chance to make a difference on a wider scale and really just overcome that frustration of waiting until somebody's sick before I could intervene to help them.
How is this hitting you right now?
I'm warm. This is, hopefully
We're getting,
more of a
it's opening up the
glow.
pores is what it's doing.
Yes.
Yeah, it's good.
I'm a blusher. This is the Scots-Irish side of the family. I'm gonna get about this color by the time we're done. Yeah.
STIs became your area. That's what you were doing here.
Yeah.
I think in my generation, the AIDS epidemic is such is so part of my consciousness growing up, and I imagine that had an influence on you as well. What?
It did.
How is this?
Much.
Yeah. How did that impact
I think
you?
in two different ways. I think one, there's always a piece of me that's been. Oh, it's still hitting me.
It's there. I know. It's just.
There's still
it's with you. It's part of who you are now.
It
It's part of
really
your story.
I'm gonna be feeling this later. Yeah. Thank you for that.
You're welcome.
I think there was a part of me that always cared about sort of a fairness perspective, and it just frustrated me that certain diseases hit certain people, certain communities harder, and HIV was clearly one of those. But part of what drew me to infectious diseases and STDs in particular were some of the hardest moments in medical school, where I was learning about these really complicated diseases that we just didn't understand and didn't know how to fix. There were entire diseases that we could wipe off the planet if we just chose to share resources with people. So syphilis is one. If we gave everyone on the planet a single dose of penicillin tomorrow, there would never be syphilis ever again. And we as a society have chosen not to do that.
Wow. Really, that's all it would take?
That's it.
It has to all be on the same day?
More or less. Before anyone can get together with anyone else.
You could probably turn that into a fun thing.
Would that be fun?
Yeah.
Would there be hot sauce involved?
Big penicillin today, and that would be a big party. Okay,
Nice.
Interesting.
So, I mean, there are island nations where this has been done for some similar diseases, and it works. Because syphilis is a disease like smallpox that can be wiped off the planet because it doesn't hang out in animals. So
Also with penicillin, what else could be wiped out? If we do this, everyone takes penicillin tomorrow. The event.
There's not a lot else that penicillin totally gets rid of. Certain strep infections, but those do hide out in some animals, things that they could make their way back.
Okay.
The other big one that we could wipe off the planet and we got close to was polio. But again, it's areas of conflict and war, it's disinformation campaigns that keep us from getting people things we know already work. It's not getting people access to medications, not getting people access to healthcare that are the reason these diseases persist, not because we don't understand them. And so it just sort of got me fired up to step in and say, how do we just solve the problems we already know how to solve? Let's start there.
Speaking of solving a problem,
You're gonna make me do it.
This one.
So wait, what out of 10 was that last one?
So this week we went off the
scale.
So let's
scale? Great.
yeah. No, because I went to a different scale. I was using because I'm not sure. This feels all made up to me anyway. But now we're gonna get on. So now we're gonna go to Scoville units. Do you know what the Scoville unit is?
I know that it exists, but I couldn't tell you if I can handle
It's
a
not.
3
It's
or
not
a 20.
a thing you use in medicine of any
No,
kind. Okay.
no.
Okay. This one was 10,000. This one was 49,000.
Okay.
And then we went to 250,000.
That was a jump. Okay.
It was a jump. And are you ready for another jump? Let's just wish for the best here. I suggest on this one we start.
Touch it.
I think. Oh, good idea. Yeah. Let's get a little. The fork will be our PPE here, and I'm gonna just go really.
Yep.
Really modest here. Okay. You ready?
I think so. Cheers. Hurts.
Now it's coming.
Yeah, I'm waiting for it.
You don't have to do this, but just for the drama of it, because it makes for good content.
Okay. Yeah, I'm probably gonna regret this, but I'll go another bite. I'm afraid to swallow.
Oh, this is bad. This one's really. This is.
I'm worried that
That's not my
hit
favorite.
me as
That
hard.
one is. This one is definitely not.
Yeah.
Is it not hitting you that hard? This one is. I'm feeling this one.
I don't know what. Oh, the milk did not help.
You have
I just washed it.
You have to find the liquid that does it right. Everyone's got.
I thought that was gonna be the right. Oh yeah, nope. It's still coming.
Gonna. I think it's gonna be. It's still. There's waves of this. There's waves of this. You've taken on this new role, and thank you for taking it on. It's an important time. Talking actually makes it feel a little better. What is and it's the federal budget situation is difficult.
Yeah. I'm listening.
Hopes and dreams for our public health department. What's the work you're most excited to get to?
So here's what I'll say, if I can get through a sentence. There is an opportunity right now to make some pretty amazing progress.
Sure.
their eyes on, hold on. So there's attention to public health policy in a way that there hasn't been. A lot of people just assume the food I have access to is the food I have access to. Of course, there's going to be somebody selling cigarettes on the corner. Of course, it's going to be dangerous to cross the street. This is just the world I live in. And it just keeps coming. Oh. I thought I'd peaked. Okay. Right now, people are saying, wait a minute, if there are things changing in my environment that makes things so much obviously worse, I might be able to change things to make them obviously better.
Yeah.
And so we're seeing people sort of take this opportunity, excuse me.
To have some milk.
We're seeing people take this opportunity to make big steps forward in health policy change. So for example, this week, the city of San Jose and the city of Gilroy passed new ordinance changes to stop new tobacco licenses.
Yeah.
Saying we need
Big
other
deal.
ways for our small businesses to make money other than making people sick. And we're gonna take this big step, this big bold step that is gonna make people healthier for generations. And now's the time to do it. I get very excited when I talk about health policy. I normally break a sweat and start crying. So this is normal for me.
You're really passionate about this topic.
I really am. It does make me feel better that you're sweating at least as much as I am.
That one was really hot.
Yeah.
Dr. Rudman, we are now having the Queen Majesty Sicilian Scorpion hot sauce. We were at 135 there, then we went to 2 million. We're back down to 250,000. I think we're going to be okay on this one.
Interestingly, this one's like hitting me a lot. Like I started to tear up just smelling it.
It's Italian theoretically, so it's you know. So this one is going to have.
Ooh, I really went all in there. We'll see if I regret that.
This one's got a sharpness to it. That
Yeah, let's see acidity.
It cuts right. It's the acidity right in there.
Right away.
Yeah, it does. So, since not everyone knows, can you tell people what a health officer is? Because it's an incredibly, as I think we all learned 6 years ago, it ends up being one of the most critical positions in local government that exists anywhere.
It is a really unique position, and
Yes.
in some way, in some ways it's unique in California, the way it's treated here compared to other states, especially at the county level. But I didn't know it existed until, let's see, the end of my fellowship training. So really only 12 years ago. And then I said, ooh, that's what I want to do.
Yeah.
So the whole point of a health officer is to carry certain legal capacities and legal requirements to keep an entire population safe. So if you start looking through California or anywhere in the country's health and safety code or state regulations, you'll see all of these places where the health officer is required to keep the water safe, keep underground storage tanks from leaking chemicals into our ground.
You do this also?
I mean, my team.
Okay.
You're
not checking the tanks.
No, but so one of the fascinating things about moving into this position is getting to go out in the field with the team that does check the underground storage tanks and make sure that there's not alarms going off and chemicals leaching into the ground.
That's
or technically, I'm legally responsible for every animal imported into the county having all their rabies shots. So there are all kinds of legal requirements that fall to me.
So you can walk up to anyone's animal and be like, I gotta check this animal out. Yeah, okay.
I could. I mean, that's part
of it. You
probably don't. Not regularly.
Yeah.
I walk up and say, can I pet your dog? It comes with a level of legal authority that I think is also incredibly unusual, that it's one of the few rules anywhere in the country and really anywhere in the county or state structure like it, where you have unilateral authority to make big decisions.
Right.
Usually we use that for things like keeping one person off an airplane with tuberculosis so that we don't get 10 more people sick, not changing the way an entire county operates. But knowing that in a real emergency where lives are on the line, somebody does have that capacity, I think is reassuring. And to know that that's going to be made here locally if that decision ever comes, as opposed to somebody in Washington, somebody in Sacramento who might not know what we need here in Santa Clara County.
Right.
I think that makes a lot more sense. Yeah, so I think it's a huge amount of responsibility that comes with an authority to make drastic change when it's really necessary that usually we use on a very judicious case-by-case basis.
It's got to be.
But it's unique anywhere.
Yeah, it's got to be very humbling and very sobering to know that these decisions fall on you, that on the one hand will save lives, on the other hand will have impacts on people.
Right.
How do you prepare yourself for that?
Whew. I mean, I think sort of just having a level of humility about every decision, that 5 minutes after I make any decision, I have to start calculating, what if I was wrong? What would I need to do differently? How am I going to find out? What piece of information could I be missing? And surrounding myself with the kinds of experts who I'm going to listen to, and making sure there are systems for really every member in the county to find a way to get me feedback about how I'm doing in the job. So, yeah.
This one is staying with us.
It really is. It's lingering.
It doesn't want to go.
No.
It really is happy where it is right now. Last question for you. We're doing this for Giving Tuesday, National Day of Giving. We are asking people to step up and make a gift to Valley Health Foundation. Say a few words on why the good people watching the show, other than laughing at us, should also go on their computer or on their phone and make a donation to Valley Health Foundation.
Well, everything I have seen come out of donations to Valley Health Foundation, which, I mean, you can't step foot in any of the county health facilities and not appreciate what an impact there is, does so much good for the county, partially because the county's whole mission is to be the safety net. It's for anybody who needs us under any circumstances, we will be there for you. That alone is enough of a reason to give, that we never know when any of us might be in a circumstance where we need to rely on a public hospital or public clinic. So even if it's not your usual place of care, we know that you're supporting a safety net that supports the entire county and might one day support you. But the idea that we're going to work more closely with Valley Health Foundation and public health means that where every dollar somebody gives, every collaboration that we're able to create out of that, means that people are going to stay healthier. They won't end up in our hospitals. They will be able to spend that time in school and with their families and in jobs and activities they love. So I'm excited for what we're going to do with the donations that come out of this. And I will forgive you soon when my eye stops leaking.
It's really bad.
If we get one donation out of this, it'll be worth it.
That is incredible sacrifice. Sarah, thank you so much for coming on the show and welcoming you as our new health officer. And thank you for taking on that role and keeping all of us safe. And I'm sorry I made you come here and be uncomfortable on camera and physically uncomfortable, but it was all for a good cause. Thank you so much.
You're welcome. Thank you for having me.